Before I begin, I want to express my condolences to the families and friends of Kim Damte. Their heartbreak, their grief, their immense pain is something that no family should ever have to experience. And I wish Kim's family and all of her friends who loved her the strength in these very, very difficult times for her and her family. As we turn towards the budget, na gwilyn rialta seo ní an tuaile chaisha ar services lente. A céad na ro an geirchim ní smasa in our services lente riau, ní ro na services seo mar hasiacht the budget agus budget and rialtas. Taoiseach, our health services are under enormous, unprecedented pressure. Hospitals are persistently and dangerously overcrowded to record levels. Hundreds of thousands of people are in treatment waiting lists. Kids are left in agony and spinal procedures that would change their lives are going undelivered. Children and adolescent mental health services are on the floor, and nurses, doctors and other frontline staff are working under conditions that are so difficult that we have a serious recruitment and retention crisis right across the board. And the chronic and deepening crisis in health sees so many of our people locked out of the care that they need. Yet looking at the budget, you would believe that the government just thought that none of this was happening. At a time when the crisis has never been worse, it beggars belief that this wasn't a priority for you in your budget, that health wasn't a priority. Our health service required ambitious investment and a radical plan, one that ensured additional beds and staff so that patients could get the right care right across the system. But instead what we got was that you gave the health service less than half of what it needs just to stand still. Not to improve, not to progress, not to turn the tide, just to stand still, and that is shocking, Minister. What happened to Minister Donnelly's promise of 1,500 additional hospital beds? He announced it on 3 occasions. That promise has melted away like snow on the ditch. And it seems that the Minister was hung out to dry by a government that has backed his incompetence every step of the way. It's very clear to everybody that Minister Donnelly is out of his depth. He has no real plan to transform our health services, and he makes it up as he goes along. But what does your failure to provide the necessary investment in health mean in plain terms? Let me break it down for you. No additional money for national strategies to improve cardiac, cancer and maternity services. No additional money to cut the cost of healthcare. No additional money for new medicines and therapies for patients with cancer. Very little, if any, additional money for mental health services and CAMS. And as Section 39 and other workers prepare to strike next week, no guarantee of addressing pay inequality for those who care for our most vulnerable. And incredibly, Taoiseach, incredibly, as your government breaks new records with hundreds of people on hospital trolleys now daily, you don't provide for a single additional hospital bed anywhere in the state. This is a budget that is a disaster for our health service. It means that the crisis in our health service is going to continue. Chronic waiting lists will continue. Overcrowding will continue, and you've made sure of that. So when things get bad in hospitals this winter, and when they get worse again next winter, remember why this is happening. It is happening because of your choices. That is why it is happening. And you had an alternative. Sinn Féin put forward a plan to deliver extra beds and the resources that our hospital needs. And what did you do? You ignored it. So my question to you, Taoiseach, on behalf of your cabinet, why did you decide to throw in the towel on health? What do you say to the hundreds of thousands of people who are locked out of healthcare, and you have failed with this budget?
Thank you, Deputy. Taoiseach.
Well, first of all, Ceann Comhairle, could I also say on behalf of myself and on behalf of the government and the people of Ireland, I wish to convey our heartfelt condolences to Kim Damte's family in Ireland and indeed in Israel. This was an horrific attack, indiscriminate, random and barbarous on the Israeli people, resulting now in up to 1,300 people losing their life, including Kim. And anyone looking at the photo of Kim in the media over the last few days would have been struck by the radiance and energy in her expression. A young 22-year-old with her full life ahead of her to be cut down in such a barbaric way. So our thoughts remain with family in particular at this very sad moment. Ní an tíam leis an teachta mother an méad bhíle rá aige ó thaobh cuasaí sláinte na tíre. Ní léon áras ach go bhritan de blianta ó thosach an bhfuilte seo go bhfuil inistíocht nabh gan áchnú inistíocht olmhór chur isteach going. Sús le seacht balún níos go le seirfisí written de blianta seachanta. Agus méadú anna bhór le feiscint sna seirfisí I gcomsaí sláinte dá bhar an inistíocht sin. So I thank the Deputy for the question, but I don't agree with him in terms of his assessment and his assertions in respect of the health service, in respect of the government's commitment and prioritisation of health. Disability has transferred to the Department of Children now, which takes with it the allocation that would have been in the health budget. That's now gone over to disability. But more fundamentally, when you look, we're looking at close to $7+ billion since 2020 now having been allocated additional to our health service, which has resulted in expansion of services across the board, expansion of capacity right across the board. And the funding this year will include staffing for new hospitals, ICU and community beds. It includes staffing for the 6 surgical hubs. It includes investments in our workforce, such as advanced practice, more college and training places, and more hospital consultants. We will continue to invest in our community services through funding for mental health services, social inclusion measures, and older people. We have recruited up to 22,000 extra people into our health service since this government was formed, and we've delivered record levels of investment in our health service. We have also cut costs for patients, which you didn't refer to at all, across the board. So we removed inpatient hospital charges. We've had the biggest expansion of access to free GP care in the history of the state, to 500,000 more people. To put this in context, up to 60% of our population now hold a GP card or a medical card. We've reduced the drug payment scheme costs. We have funded diagnostic scans for patients. We've introduced free contraception to women up to the age of 31, and we're now publicly funding assisted human reproduction, including IVF. We've agreed a new consultant contract with over 800 consultants already signed up. There's been a 22% reduction in patients on waiting lists who are exceeding the sláinte care waiting time target since the COVID peak. And we've built up in just the past 2 years an entire new community health service, including primary care, chronic disease management, older person services and ambulance services. And as I've said, we've added 22,000 new staff since 2020, and we've increased our hospital bed capacity by over 1,000 in the same time, and we've expanded our ICU bed capacity and it's not just beds, of course, it's the multidisciplinary teams that go with that, and we've built a network of new primary care centres around the country. So this level of investment is helping the health sector to meet the increasing levels of demands that it is meeting. And we now have one of the highest life expectancies in the European Union. Our survival rates for cancer, for stroke, for infant mortality and heart disease have hugely improved. And our outcomes clearly show that our health service is delivering quality care across hospitals all over the country. And we are, I can deal with it in the supplementary.
Taoiseach, what land are you living in? Walk into any of our hospitals, any day of the week, any week of the year. You will see patients on trolleys or in chairs that have been admitted to hospital but can't get to hospital into a bed. Why? Because the beds don't exist. The ESRI is telling you that you need 1,000 beds right now and about 300 to 400 beds every single year. Your minister said that he was going to deliver 1,500 rapid beds. The Department of Health even put out an expression of interest. You funded not a single euro for any additional bed, despite the fact that you have broken new records in terms of the numbers of people overcrowding in our hospitals in A&E in the start of this year. Over 900 patients without a bed lying on trolleys. That's the facts, Minister. Since you took office, our waiting lists are growing. 40,000 more people languish in waiting lists. We have people who are waiting for critical surgeries who aren't able to get it year after year because the investment isn't made. And the Department of Health and the HSE told you what was needed to stand still, to leave the crisis that we have just at the same level next year. They told you what was needed and you funded half of it.
Thank you,
Your
Deputy.
own minister acknowledges that you have underfunded health. So why did you throw in the towel? You know you've thrown in the towel. Why the government decided to do this and they decided to abandon all of these patients that we'll hear about in the weeks and days to come.
That's your new phrase, is it? Throw in the towel? I've heard it the other day. There was one or two other phrases that becomes the norm during opposition, your missed opportunity, etc., etc., etc. The bottom line is, Deputy, you have not acknowledged the fact that there has been unprecedented and record levels of investment in the last 3 years in our health services. You have ignored the fact that we've come through a one-in-a-century global pandemic, which has had a huge impact on our health service and continues to have an impact on our health services with, yes, dramatic increases in attendances, in treatments, in people requiring interventions. And we have not been found wanting. We have not been found wanting over the last 3 years in relation to our health service, and we will not be found wanting again. And you can shout all you like, and you shout a lot. And you certainly shout when other people are, when you are endeavouring to refuse other people an opportunity to speak. Shouting and roaring about issues doesn't solve them or doesn't resolve them. I acknowledge, through the chair, that we have huge challenges facing health, because when a budget in 3 years goes up to $7+ billion, we do need to take stock.
Time is up now.
We do need to analyse, and we need to prepare for the future, which is what we have done. Which is what we've done with the investment funds that the Minister for Finance has provided.
Deputy, please.
I apologise, but the patients will suffer.
Please.
Patients are going to suffer in
No.
every single constituency as a result of this, and the government knows it, and the backbenchers know it also. Your minister is telling us. Your minister is telling us.
Deputy, can we move on to Deputy Holly Kearns?